Hello, everyone. Congratulations to making it to Organizing 201. I am Jessica. I'm an acute care resource nurse, and I am interim president of Utah Health Workers United.
And I'm Talmadge. I am the interim vice president, and I am a medical assistant slash AEMT at Huntsman Cancer Clinic 1A.
I'm Shyla. I'm a nurse at the Madsen Outpatient Clinic.
I'm Lena. I'm an RN in the ED.
Here is our agenda. In this presentation, we will be covering organizing starts with conversations. We use an acronym known as SIVA, overcoming objections, being systematic in assessments and list work, department mapping, and charting on next steps. It is rare for people to join a union unless they're individually approached and asked to join. If we don't ask them, we are making their minds up for them. The more people who are asked to join, the more who will join. You cannot get hundreds of workers to join the union unless you have hundreds asking. You get hundreds asking with strong organizing committees. Strong organizing committees mean people are meeting regularly, working with lists, making plans, taking assignments, and reporting.
My name is Jane McAlevey, and I am an organizer. I've been running campaigns across the environmental movement, the trade union movement, and then sort of political races, right, for candidates or ballot initiatives. There's one central thing I've taken away from the last 30 years of winning, helping people to win a lot of campaigns. And it's that in order for our side, the forces of good, to build the power that we need to win and win big, can win small things, but we actually need to win some big things at this point in America. So to build the power to win and win big, we have to spend way more time organizing, and we have to spend less time mobilizing. And I want to say what they are in the next minute. Organizing is about base expansion. It's about how do we bring people who are not yet convinced that the way to win is by their involvement. How do we actually bring them into the work with us? The truth is, we have to spend a lot of time convincing the unconvinced that they need to join up and participate in order for anything in this country to change and change for the good, right, for the majority. What most activist groups do, unfortunately, is spend all their time doing what I call mobilizing, which means they spend all of their time talking to people who already agree with them. And if you spend all your time talking to people who already agree with you, all you're trying to do is get them to a rally, to vote, to march, to something. But that's very different than spending our time trying to persuade new people who have not been involved previously to get involved in the work. We need to do way more of that. Then the mobilizing is easier because we're working from a pool that's much bigger with many, many, many more people involved. So we need to do more organizing and not as much mobilizing. So when we think about persuasion, if that's a lot of what we have to do is persuade unconvinced people to get into the work, the persuasion works like this. It's about a 70-30 ratio. You have to spend 70% of your time in any conversation listening to the person that you're talking to or to the group of people that you're talking to, and no more than 30% of the time talking. 70-30 is the rule for an effective conversation. And then you have to show it. Like if someone says, I care a lot about healthcare, my family and I can't afford it, you have to actually repeat back at some point. So I hear that you and your family actually think that healthcare is a really huge crisis in America. You have to say it back so that they know that you're listening. You're not just sitting there like a robot, you're actually listening and engaging. And then lastly, you have to be able to do something called framing the choice. I'm going to stick with healthcare. If I'm talking to somebody and I'm trying to persuade them to get involved in the incorruptibles and do some work with us, and they tell me that their family can't afford dire healthcare issues that they are dealing with, I'm going to actually at some point frame the choice for them. I'm going to use the word you a lot in the conversation, as in you. And I'm going to say, look, the truth is, I hear you that you want a better healthcare system in this country, one that's more affordable. If you and your family don't get involved, the truth is nothing will change. That's framing the choice. You have to look at someone, listen to the issue that matters to them or the issues, repeat the issues back, and then frame the choice for them. Nothing's going to change if you do nothing. Things will only change if you decide to act. That's persuasion.
SIVA is an acronym that is a communication tool that organizers use to guide conversations. These conversations are not a sales pitch. They are meant to build solidarity with you and your coworkers. To get to know them better, learn what they value, and build trust so that we can effectively organize for a change.
The first part of SIVA is the C for connect. This first part of the organizing conversation is more relevant for coworkers you don't know very well. The main objective in this stage of the conversation is to build rapport and trust. This will help to then identify their issues at work. Most people aren't candid about work if there is not trust established. Think of the typical response when a stranger is asked, "How are you?" They say, "I'm good." This often is not a full representation of how they are actually doing. Every employee struggles with something at work. When they identify those issues, we can connect with what they value. We need to have a practical approach to organizing, not an idealist one. We have to consolidate the self-interests of as many workers as we can under a common set of values and goals. People are more likely to take action when the goal is valuable to them. Ask yourself, why are you here? What is your self-interest? Here are some examples of how to use the connect component of SIVA. Introduce yourself. Hi, I'm Shyla. I work down the hall and I'm a member of Utah Health Workers United. Have you heard about us? Get to know them, such as how long have you worked here for? Have you always done this kind of work? Why did you become a nurse or an MA? Identify what they'd like to change at work. Do you like working here? What would you like to see changed? Up next in SIVA, we have E for engage. Here we aim to get people fired up, to recognize the injustice of the issues we face at work. The feeling of anger towards injustice is called righteous rage. Emotions drive people to take action. In this stage, we should be asking questions and listening, mainly listening. Here are some examples of how to approach this. How does it make you feel when patient care suffers because of understaffing? How does your wage impact your ability to take care of your loved ones and yourself? What will happen if staffing doesn't improve? Who made the decision that employees have to pay to park at work? Next up, we have vision, which is the V in SIVA. Here we focus on presenting our general solution to the general problem. In the vaguest terms, our solution is to work together with as many coworkers as possible. Collective action is much more powerful than trying to change things on our own. We also want to explore our coworkers' ideas on how we can make change. An example of addressing this would be asking, have you ever tried to address an issue, such as safe staffing, with your supervisor? Did you have any success with that? What was their response? Listen to your coworkers share their experiences. It's likely they didn't have much success on their own, because we know we are more likely to be successful when there are large numbers of us working to hold the top leadership teams accountable.
Okay, the last part is A for ask. Here, the focus is to test them. This is the hardest part of SIVA because asking people to take action can be uncomfortable. This stage is pivotal in their and your own development. They become an activist and you become an organizer. This is where conversations lead to actions. Assumptions are the enemy of an organizer. It may seem uncouth or not polite to be so direct, but if we are not direct about what we are doing, we are inferring that it is not important. Soft language is unproductive in organizing conversations. Instead, we need to be clear. Don't say, let me know if you're interested. Instead, ask bluntly, will you become a member of UHWU? If they say no, investigate why and follow up again soon. If they say yes, get them to sign up or take action then and there. Although organizing starts with a conversation, it surely does not end there. Good organizing conversations lead to firm asks. Firm asks lead to decisive actions. Decisive actions lead to true assessments. True assessments lead to effective list work. Effective list work leads to effective strategy, tactics, and methods, and effective strategy, tactics, and methods lead to campaign success. When we talk to our coworkers, we will make assessments of how much they support our union. How do I know how to rate someone's support? Get to know them, ask them to sign the petition, pay dues, come to a meeting, etc., and see if they do what they say they will do. We classify them into 3 groups. 1s are our biggest supporters, 2s are borderline, and 3s are anti-union. List work is a systematic gathering of information, primarily through conversations and interactions at work, which help inform us on the nature of our workplace. Information is power. It allows us to strategize, it keeps ourselves accountable, it builds efficiency and organizational sustainability. Here's an example of a template for list work on a spreadsheet. List work does not have to be done exclusively through Excel or any other digital database. You could simply write out a list on paper. Though paper lists will require more interaction with fellow organizers in order to effectively access and utilize that information.
Although list work tends to be done digitally through database systems, department mapping and charting often are not. What is mapping and charting? These are methods for organizing that require a group effort because no one person holds all the information. This is most effective when done with workplace leaders. It should be done continuously and at all stages of the campaign. On this slide, you'll see a myriad of ways you can quantify your coworkers' support. These methods may work better in some departments or units than in others. It's up to you to look at your department and consider which may be more effective. So how do you define a leader? This is someone who you notice speaking up as an advocate for patients and coworkers. They probably have a good reputation and are well known in the department. On the slide, you can see our ones identified in green. The leaders have stars next to their names. If you look at shift 2, for example, you'll note they lack a department leader. Patty and Rosa are both ones. It would be good to ask one of them to be the leader for their shift. These leaders turn into a key point person to spread updates and gather coworkers' opinions. In order to make effective changes, we need to identify leaders in all departments and on every shift. This is another way to organize information. This format groups coworkers into sections based on their social groups and who's friends with who. Based on this view, we should focus on communicating with the groups with more yellow and transforming them into ones. The groups with all green can be self-sufficient and designate a leader to keep them in the loop. That concludes this presentation. Here's some homework for you. Meet up with some coworkers and practice having conversations using the SIVA method. Start making a list of your coworkers and assess their level of support. Come out to our meetings and events and invite the ones in your unit to join. Thanks for watching.